New at 5:30, as we approach Thanksgiving, many of us find even more reasons to be thankful, including a Mount Carmel surgeon. After decades of saving lives, he's grateful that his colleagues are now saving his.
How often did you tan to get that tan?
Every day.
When Dr. Philip Price was in college, he became a competitive bodybuilder and won an intercollegiate title. To show off his muscles on stage, he darkened his skin in a tanning bed. Now he's paying for it. The cancer surgeon got cancer.
I have your drug on mix.
You know, I had dedicated the majority of my practice to the treatment of gastrointestinal cancers. And I guess it shows, you know, that it can happen to anybody.
His wife, Brandy, noticed a spot on his back.
And I really didn't even know that spot was there. And my wife noticed it and said, you know, this has changed.
It was melanoma, a deadly form of skin cancer. Doctors removed it, and this surgeon kept on working. Then last June, Dr. Price told a resident that he felt funny, had trouble talking, needed to go home.
And I got home and called my oldest son, and by that point I really couldn't communicate.
The cancer had spread to his brain. He'd had a small stroke. After brain surgery, Dr. Price joined a clinical trial for a new kind of drug. Standard drugs kill both cancer cells and healthy ones.
These immune drugs work by targeting the tumor rather than targeting the whole body. That's, you got to do it till it burns.
Now he's well enough to exercise with his son. This former bodybuilder is keeping his body in shape while the drug keeps his cancer in check. His surgical days are behind him, but Dr. Price still plans for the future.
For whatever time I have left, whether it's 6 months or 6 years or whatever, to just, you know, enjoy life and keep living it.
Dr. Price needs just half an hour of chemotherapy every 3 weeks to keep his cancer from growing. He says this drug is no longer experimental. It was recently approved by the FDA. And doctors say it's important to remember the ABCDEs of skin cancer. Check your moles to see if they are asymmetrical or oddly shaped. Check the borders to see if they are irregular. Has a mole changed in color? Check the diameter. If it is larger than a pea, have it checked by a doctor. And see if the mole is evolving. Has it changed in just a couple of weeks? You can learn more about skin cancer right now at 10tv.com/health.